Fatty liver disease, symptoms, causes, and the latest treatment approach. Today, let's talk about one of the most common yet silent health threats, non-alcoholic fatty liver disease, or NAFLD. You might feel completely fine, and even your blood tests might look normal, but behind the scenes, your liver could be under serious stress. What is fatty liver? The liver plays many essential roles, detoxifying the blood, regulating blood sugar, producing bile, and more. When fat accumulates inside liver cells and exceeds 5% of the liver's weight, we call it fatty liver. If this fat buildup happens without inflammation or liver cell damage, it's called NAFL, non-alcoholic fatty liver. But when inflammation and cellular injury are also present, it progresses to a more serious condition called NASH, non-alcoholic steatohepatitis. Why does it matter? Fatty liver is more than just a number on your lab report. If ignored, it can lead to liver fibrosis, scarring and stiffening of the liver tissue. Over time, this can progress to cirrhosis, which severely impacts liver function, and eventually to liver cancer in some cases. Who is at risk? Based on the latest guidelines, certain groups are more vulnerable. People who are overweight or obese, individuals with type 2 diabetes, those with high blood pressure or abnormal cholesterol, people who live a sedentary lifestyle, women with polycystic ovary syndrome, PCOS, even people with normal weight, especially those with abdominal obesity, central fat. How is it diagnosed? Diagnosis can be tricky because liver enzymes such as ALT and AST may still be normal. That's why doctors often recommend abdominal ultrasound for high-risk individuals. In more advanced cases, more accurate tools like FibroScan, which measures liver stiffness, MRI-PDFF, or even a liver biopsy may be needed to assess the severity of the disease. How is it treated? Based on current guidelines, the first and most important approach is lifestyle modification. 1. Weight loss. Losing 7% to 10% of body weight has been proven to significantly reduce liver fat, inflammation, and even reverse early fibrosis. 2. Healthy diet. The Mediterranean diet is the most evidence-based approach. High intake of vegetables, fruits, legumes, nuts, and olive oil. Moderate consumption of fish and low-fat dairy. Limited intake of red meat and processed foods. Avoiding sugary drinks and added sugars. The DASH diet, often used to manage hypertension, is also effective. Regular physical activity. Exercise helps reduce liver fat and inflammation, even if there's no significant weight loss. Aerobic exercises like brisk walking, cycling, swimming, or dancing. At least 150 minutes per week of moderate to intense activity. For example, 30 minutes per day, 5 days a week. Strength training is also helpful for improving insulin sensitivity. Are there any medications? Currently, no medications have full FDA approval specifically for NAFLD or NASH. But in certain situations, some drugs might be used under medical supervision. Pioglitazone, used in patients with NASH and type 2 diabetes. Liraglutide, Victoza, or semaglutide, Ozempic, Wegovy, for overweight or diabetic patients. Vitamin E may be used in non-diabetic patients with confirmed NASH. What makes fatty liver worse? There are a few things that clearly worsen the condition, and they're surprisingly common in daily life. Sugary drinks, like soda and packaged fruit juices. Their high sugar content directly increases liver fat. Processed red meats, such as sausages, salami, and fast food burgers. trans fats found in ready-to-eat meals, snacks, and fried foods. Inactivity. Even with a good diet, lack of exercise keeps the risk high. Irregular sleep patterns and chronic stress can also worsen the condition. Indirectly. Final thoughts. Fatty liver is a silent condition. Many people live with it for years without knowing it. But this silence doesn't mean it's harmless. With lifestyle changes, healthy eating, regular physical activity, and medical follow-up, you can stop the disease from progressing or even reverse it. If you or your loved ones are at risk, start taking action today. Even small steps can help you avoid a much bigger problem in the future. If you enjoyed the video, like, comment, and subscribe. Thanks for watching.